Good afternoon, everyone, and welcome to today's session of the Neuro-Oncology Wellbeing Program. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful for the NOW team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the Q&A feature or the chat feature, and the questions will be answered at the end. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center, or you can email us at blum_center@dfci.harvard.edu. I will now further introduce today's program. Welcome for the first part of this two-part series on exercise for brain tumor patients, led by Dr. Nicholas Gonzalez Castro, Director of the Neuro-Oncology Wellbeing Program. Dr. Gonzalez Castro is a neuro-oncologist at the Dana-Farber Center for Neuro-Oncology and an associate neurologist at the Brigham and Women's Hospital. In addition, Dr. Gonzalez Castro is also a certified personal trainer under the American College of Sports Medicine and has received the Exercise in Medicine certification from the same organization. We remind you that this program is made available for educational purposes only, and that the information presented is not intended to substitute the recommendations of your personal physicians or other qualified healthcare providers. Now I will pass the presentation over to Dr. Castro to get us started.
Hello, everyone, and welcome. Thank you, Becca, for the introduction. And I will go ahead and share my screen to have some slides that I want to share with you. So as Becca was mentioning, this is the first part of a two-part series on exercise for brain tumor patients. And I will be covering a number of different concepts, but we want to make it interactive as well as we have done with some of the previous webinars on disease-specific topics. So enter questions in the Q&A or chat feature, and towards the end of the presentation, I will go over those questions and we'll address them. These are some disclosures that I have to make, and none of them are relevant to the contents of the presentations that I'm going to be giving today. I wanted to take a minute for those that are not familiar with the Neuro-Oncology Wellness Program to give you an overview of what we do. As many of you know, as patients or caregivers, we're devoted to the care of patients with brain tumors in the clinic. But in addition to that, we wanted to be able to support our patients beyond the time that they spend with us here at Dana-Farber. So we are looking into providing a number of different opportunities for patients to know more about their disease and be more empowered with their clinical care decisions. And for this particular purpose, we have designed the whole series of webinars on specific conditions such as glioblastoma, and IDH mutant glioma, on brain tumor symptoms. The most recent one we had was on CNS lymphoma, and we have a number of additional webinars coming up on disease-specific topics. But beyond that, we wanted to provide some additional information to try to help our patients work on their physical and emotional health to be strong and resilient through the entire arc of their disease, and be able to make the most out of their day-to-day activities and their daily lives. Lastly, we want to create community, because we know that patients, when they're able to share their experiences with others and hear from the experiences of other patients, they are able to better care for themselves, and have an opportunity to really share some of the experiences that are very unique to themselves, and realize through sharing with others that other ones experience similar things, and maybe learn about strategies to manage different circumstances. So we have a series of workshops and support groups, both for patients with high-grade and low-grade gliomas, that many of you participate, but if you're interested in participating, let us know and we will send you that information. The goal of today is to talk about exercise and explain why exercise is important for brain tumor patients. So over the entire series, we're going to be answering a number of different questions: what, why, how, and when. And the goal for today is to address the first two questions. What is exercise, and why should cancer patients, or more specifically brain tumor patients, be involved in an exercise program? In the next part of this series will be in 3 weeks on October 11th. We're going to be talking about how and for how long should patients be exercising, and when should patients be exercising, along with a few other specific recommendations for brain tumor patients. We might get into some of these aspects today, but essentially to not overwhelm you with information in one long talk, we have split this into two. But we'll be addressing some of these aspects, and even if you join us for the next session, we'll summarize some of the information we share about the first two questions. So why are we talking about exercise and trying to define exercise? With any activity that one engages in, it's important to have an understanding at an intellectual level of what exactly is it that one should be doing, and why is it that it's important to do something. So to have a common language, we're going to go over certain definitions, and then I'm going to be sharing with you some of the evidence and the recommendations that are available for cancer and brain tumor patients regarding exercise. And my goal here is to give you enough information for you to think. And if you're not participating in an exercise program already, be convinced that this is something that is important, that is powerful, it can have a very powerful effect in your overall well-being, and is something that has been studied and is recommended by some of the major cancer medical societies. So we'll define a couple of terms to begin with. One is physical activity, and physical activity is any movement produced by the contraction of skeletal muscles that results in substantial increase in caloric requirements over resting energy expenditure. And I'll break this down for you. I am sitting here on a chair, and now I'm talking to you, but if I were just to be in silence, my body will be in a state of very limited metabolic activity. The energy that is being used is essentially the energy needed to maintain my normal or vegetative bodily functions, to keep my heart from pumping blood throughout the body, my diaphragm for expanding and contracting to be able to bring air into my lungs, to then bring oxygen to the rest of the body through circulation. Basic activities for brain maintenance and for other organ maintenance. But that's your basal or your baseline metabolic activity. Physical activities, anything that involves contraction of skeletal muscles. These are muscles that are attached to bones, such as the muscles of the arm. And through contraction of the muscle, we get movements of the bones. We have other kinds of muscle, such as cardiac muscle, that through contraction helps pump blood throughout the body. And then we have muscle in our gut, for example, that helps contract the gut to move nutrients around the GI tract. But physical activity is specifically defined in terms of contraction of skeletal muscle that lead us to increase our metabolic rate, our rate at which we burn calories, at a rate that is higher than the rate that we do so at rest. Okay, and that also involves, cardiac muscle activity, because as the skeletal muscles start being activated and consuming more oxygen and nutrients, all that is delivered via the blood, and that engages the activity of the heart as well to help pump all that blood to our muscles, and at the same time, through that circulation, remove any waste products from muscle activity. Now, exercise itself is defined as a type of physical activity consisting of planned, structure, and repetitive bodily movement done to improve or maintain one or more components of physical fitness. Okay. And then that brings us to physical fitness, which is the ability to carry out daily tasks with vigor and alertness without undue fatigue and with ample energy to enjoy leisure time pursuits and meet unforeseen emergencies. Physical fitness is composed of various elements that can be divided into health related and skill related components. Okay, so exercise is a structured, planned activity or series of activities that involve repeated body motion to help improve physical fitness, which is the ability to do the things that we need to do in our daily life with vigor, with alertness, without excessive fatigue, allowing us to have time then to do other things as well, and to be able to counteract any kind of challenge to our body, such as an illness or a fall, or um, you know other situations that we encounter in daily life and that patients encounter as well in the arc of their disease. And then physical fitness is divided into health and skill related components, and I'll highlight this here. Health related physical fitness includes cardiorespiratory endurance, the ability of the heart and the circulation and the respiratory system to supply oxygen during sustained physical activity. So, cardiovascular and cardiorespiratory endurance is the ability to, you know, crank the engine up and keep it going for a period of time to be able to support the physical activity of the body. Another component is body composition. So the different amount of muscle compared to fat, compared to bone, um, and other tissues of the body. So through exercise, the body exercise is a stimulus that leads to changes in the body, and the body adapts to that stimulus by, for example, building up muscle tissue, increasing muscle mass, um, decreasing oftentimes fat stores, because that is consumed, that is energy that is consumed to help sustain the muscle activity. Different specific kinds of physical activity also leads to adaptations in bone. They can lead to bone being strengthened and being hardened and make it more resilient to different challenges. Um, Another component is muscular strength, which is the ability to exert force using our muscles. So, if we lift a gallon of milk, um, we are able to, generate a force against gravity to be able to, displace that mass, which is the gallon of milk, and that requires a certain amount of energy. Um, and if we, keep exercising muscles, eventually, in addition to being able to lift a gallon of milk, we might be able to lift, heavier objects such as a, 15-pound or 20-pound dumbbell. And that strength, can also assist us with our activities of daily life, such as, helping us get out of bed or helping us stand if we sustain a fall. Muscular endurance is another aspect of muscle function and is one of the health-related physical fitness components. And this deals not with the ability of the muscle to produce force, but to the ability of the muscle to produce force over time without fatigue or delaying the onset of fatigue. So, for example, being able to lift a gallon of milk not only once, but being able to lift it 20 times. Let's say that you went to the store and you ended up with 6 or 7 bags of groceries. You're lifting one, and you're exerting a force and making use of your strength. But then as you continue to unload bags, then you're relying on the endurance aspect of the muscle, the ability to be able to do all these lifts one after the other and not fatigue, not having to take a break, when you just unloaded 3 of the bags. So by working on that component, you're able to perform a certain activity for a longer period of time. And then one aspect that is often missed, but is incredibly important, is flexibility. And this has to do with the range of motion that is available, that we can perform around a joint. Muscles have tendons at the end that insert into bones and act across a joint to be able to perform a certain movement. And if we don't work on our flexibility, the ability to extend and elongate our muscles and our tendons, we start losing our range of motion. And when we lose our range of motion, we lose our ability to produce force. We eventually, as the muscle cannot contract through a big range, we need to do more frequent contractions to do a certain activity. So we might be able to, we might have a loss of endurance. And in addition to that, we're more prone to have injuries when a particular limb at times is overextended and there's limited flexibility. That can lead to a muscle or a tendon tear. So working on flexibility is also another important aspect. In addition to the health-related components, there are skill-related components. And this relate to the ability to integrate the function of different muscles to perform certain functions, such as agility, the ability to change position of the body in space with speed and accuracy. So for example, someone tosses something to you and you're able to lean forward and catch it. Someone, for example, you're walking and then you notice a change in the pavement and you have to make a jump and land, in a safe way, in a rapid way, or you're walking down the street and someone is skateboarding and they come close to you and you need to move out of the way. So agility is the ability to change position with speed and accuracy. Coordination is related and is the ability to use your senses and your different body parts to perform your tasks smoothly and accurately. When one is coordinated, the movements tend to flow. There's the component of agility, of being able to move with speed and accuracy, but at the same time, you move in a smooth way through space. So it's like, think of a ballerina or a skilled dancer, doing a certain routine, and compare that to a robot, for example, or a humanoid robot that we see sometimes on TV, and how their coordination is somewhat impaired, so they move in a way that is not very smooth. Balance, another key element, is the ability to maintain equilibrium, either when you're standing or when you're moving. And exercise also contributes to improvements in balance. Power is the ability to produce force with a certain speed. So one might be very strong, but it is said that a person is powerful if you can exert that strength with a lot of speed. Some of the power lifters that you see sometimes on TV that pick very, very heavy weight and very quickly lift it up, as we sometimes see in the Olympics. Reaction time is the ability to react to a certain stimulus. The time that goes between you perceive the stimulus and the time you produce that reaction. And then speed, as we know, is the ability to perform a movement within a short period of time, or shorter and shorter over time as we gain more speed. Another important term to define is exercise intensity. And then when we get into discussing, how we should exercise and, what type of activities are conducive for brain tumor patients, we'll be talking about exercise intensity. And also in a few slides, when I share with you some of the data that is known on mortality, it's important to understand the concept of exercise intensity. So there are different physiologic measures related to different things that change as our body performs different functions that help define exercise intensity. So there is volume of oxygen uptake reserve, or VO2R. There is heart rate reserve, oxygen consumption, or VO2, and a concept that some of you might be familiar with or might have heard about, VO2 max, the maximum amount of oxygen that you can process, that your muscles can process during a certain activity, your heart rate, or the concept of metabolic equivalent. And a metabolic equivalent is defined as 1 kilocalorie per kilogram per hour, and it has another definition in terms of amount of oxygen. But one way to think about it is that your basic or your baseline metabolic rate, if you're sitting quietly, is equivalent to 1 metabolic equivalent, or 1 MET. And METs, or metabolic equivalents, are a standardized way to describe the intensity of different type of exercises. So light intensity exercise is defined as requiring between 2 and 3 METs. Moderate exercise is between 3 and 6 METs, and vigorous exercise is 6 or higher. So in this table here, now if you can see that if you're walking slowly around the home or the office, this is equivalent to 2 METs. If you're doing some work around the house, such as making a bed or washing dishes or cooking food, this is usually about 2 to 2.5 METs. And there are other activities here, for example, arts and crafts, or playing billiards or pool. This is like 1.5 and 2.5. Boating on a power boat is 2.5. Croquet, darts, fishing. These are all in the range of 2 to 2.5 METs, and that's very light intensity activity, or very light exercise intensity. In the moderate range, then we see walking. For example, walking at a rate of 3 miles per hour. That's walking a mile over 20 minutes, which is not really fast walking, but it's a reasonable walking pace. That's equivalent to 3 METs. If you walk at a very brisk pace, 4 miles per hour, so that's covering 1 mile in 15 minutes, that brings you up to 5 METs. Okay. And there are some other household occupations that are more intense, such as washing windows, or washing a car, or cleaning the garage. That's usually around 3 METs. Sweeping floors or vacuuming, that's around 3 and 3.5. You see there are other examples. And then it gets into sports, different sports. So for example, badminton is about 4.5 METs. Basketball, if you're just shooting around the ball, is about 4.5. Dancing can range between 3 and 4.5. Golf, if you're walking and pulling your clubs, that's usually 4.3. If you're just walking, it's just the equivalent, walking pace, anywhere between 2 and 3 METs, usually for most golfers. Playing tennis doubles is about 5 METs. And then you get into the vigorous range. These are activities at which you're, really making your body work hard, and the intensity really goes up. So walking at a very brisk pace, 4.5 miles per hour, that's 6.3 METs. Hiking up steep grades can be up to 7.5 to 9 METs. Jogging at 5 miles per hour, that's 8 METs. Jogging at 6 miles per hour, that's 10 METs. 7 miles per hour is 11.5. So you see that very quickly, jogging and running are some of the most metabolically intense activities. And as you increase your pace, the intensity quickly goes up. Um, a very intuitive measure of intensity is the uh, respiratory demand. How our respiratory rate goes from a normal rate, which is usually about 10 or 12 breaths per minute. When we're doing something more vigorous, our breathing might go up to 20 or 30 or 40 breaths per minute. And our heart rate will come along with that, increasing as well. But I think that many of us have an intuitive idea of how intense something is just by the rate of our breathing. Other occupations in the household, like shoveling sand or coal, around 7 METs. Farming, for people that, or really heavy duty gardening, that can come up to 8 METs. There are other activities, other sports, such as biking on a light, flat terrain is about 6 METs. They're playing a basketball game, like one-on-one or as part of a team, that's more in the range of 8 METs. And there you see it, cross-country skiing, soccer, swimming, these are all in the range of 6 to 7, 8 or plus METs. So you get an idea of what we mean when we talk about intensity, is how much we're making our body work beyond the baseline activity that it has just to maintain all normal body functions. Now I want to talk very briefly, and this would lend itself to be a series of multiple, lectures of discussions on the health benefits of exercise. And I'm just gonna give them to you as bullet points here, but I'll just preface this by saying that if exercise were a medicine, it would be the most valuable medicine that we have to offer our patients. Period. More valuable than any, medication, heart medication, any cholesterol medication, more valuable than any chemotherapy that we offer here or radiation or any therapy we offer here at Dana-Farber, more valuable than any medication that we can offer our patients for their mental well-being. It is indeed, one of the most effective things. And it's amazing the range of benefits that it has in terms of body systems and overall health. So just to highlight, it is well known that exercise leads to improvements in cardiovascular and respiratory function, including, and these are all coming from different studies that have measured specific things. So maximal oxygen uptake, resulting from both central and peripheral adaptations. So adjustments in the heart and in our circulation, decreased minute ventilation at a given intensity, decreased myocardial oxygen cost for a given amount of effort. So, our heart becomes more efficient. Heart rate and blood pressure are also improved. So our heart rate goes down, our heart can pump more efficiently, so we don't need to have as many beats per minute to get blood to all our body. Our blood vessels also become more efficient, and exercise can reduce blood pressure. Many folks, our patients and many patients out there in the community, and many individuals have high blood pressure, and it's well known that exercise can help manage blood pressure. And it's often something that is overlooked in the initial management of blood pressure. We have many blood pressure medications, it's very easy to prescribe them, but it has been known for a long time that patients that engage in an exercise regimen can over time lower their blood pressure and in some cases even come off medication. Increase circulation to skeletal muscle, increase our threshold to work in conditions where our muscles are producing a lot of waste, lactate or lactic acid, that is and generally thought as a waste product of muscle activity, but has a number of other functions as well. But this gets clear from the circulation. But if we work at a very high intensity, is the sense that we get when we say that our muscles are burning, is that experience that is induced when there's a high buildup of lactic acid. Through exercise, we are able to, build up higher levels of lactate or lactic acid and continue exercising through that. And then increase exercise threshold. So increasing the ability to do more, even in the setting when we have some limitation from our cardiovascular standpoint. So patients that have heart disease, and for example, if they exercise for a very short period of time, or exert themselves for a short period of time, such as walking a little bit, they might get chest pain. Through careful implementation of an exercise program, patients are able to increase their exercise capacity, so they're able to do more even when they have an underlying condition. As we mentioned, exercise has an effect on cardiovascular risk factors, so reducing blood pressure, increasing high density lipoprotein, which is correlated with improved cardiovascular health. That's your HDL cholesterol, as well as a decrease in the amount of triglycerides, which is also associated with improved cardiovascular health. Reducing total body fat, including intra-abdominal fat. Fat is important, has a number of functions in the body, and it's a very interesting organ. And we all have some amount of fat under our skin, and we tend to accumulate fat in different areas of our body. But the most dangerous fat that we have is the one that builds up over time around our internal organs. If you have had a chance to see a surgery at some point, or see a surgery on TV, oftentimes as individuals gain weight, they gain it on the outside, but they also build fat inside their belly and around their organs. And the increased amount of that intra-abdominal fat is associated with worse overall health outcomes. So exercise can reduce that. Reduce insulin needs. Insulin is a hormone produced by the pancreas that helps bring in sugar into different tissues of the body. And if we consume a lot of sugar over time, we can develop a condition where our muscles become insensitive to insulin, so don't respond as well. This is the type 2 diabetes or adult onset diabetes, in which patients oftentimes need to take medications or give themselves insulin to help bring the sugar from the blood into tissues and reduce the elevated sugar levels in the blood. Through exercise, you can reduce that. Your muscles can uptake glucose, the sugar that is used for muscle function, in a way that is independent from insulin and can reduce insulin needs. Also, through exercise, you can reduce the stickiness of platelets, which are these small pieces of cells that are in our circulation and help form a plug when there's a cut or an injury, externally or internally. But if these tend to aggregate, they can form large clots that can be dangerous, for the heart or for the lungs or for other organs. And through exercise, there's an effect on reduce, stickiness and aggregation of platelets. And then there's also an effect of reduce inflammation with chronic exercise. Acutely, when one exercises, immediately there's a small increase in inflammation, but then over time, inflammation decreases in patients and in individuals that exercise regularly. So that's just one aspect of it. There's an effect of exercise also on our overall well-being and our mortality. So, higher activity or higher fitness levels are associated with lower deaths from cardiovascular disease. And they're also associated with lower incidence or lower occurrence of cardiovascular disease, coronary artery disease, stroke, type 2 diabetes, metabolic syndrome, which is a combination of insulin resistance and high lipids, and a few other measures that define that syndrome. Bone thinning leading to fractures, osteoporosis, as well as a decreased incidence of a number of cancers, including colon and breast and gallbladder. As a secondary prevention, so this is for patients that already have some of these diseases. There is improvements as well in terms of cardiac function and metabolic function, as we have alluded before. There are additional benefits that are important as well. Exercise has an important effect on mood, and patients that exercise and exercise regularly are known to have lower levels of anxiety and depression, to have improved cognitive function. It is routinely recommended for patients that have neurodegenerative diseases, such as Alzheimer's disease, or are at risk of developing Alzheimer's disease. They have a pre-Alzheimer's condition called mild cognitive impairment, to engage in an exercise program, because we know that exercise preserves cognition. One direct way that it does that is by maintaining healthy blood vessels going to the brain and helping our brain, get all the nutrition, all the oxygen that it needs throughout. It can lead to enhanced physical function and independent living in older individuals. We know that elderly individuals that are fitter are able to remain independent for longer. Related to mood as well, patients that exercise have an increased feeling of well-being. You can have improved performance at work and other recreational sport activities. Another key benefit is a reduced risk of falls. And if you happen to fall, a reduced risk of injury from falls. Falls are a major cause of morbidity and mortality, of injury and of death, because despite the fact that many times individuals survive an immediate fall, the complications of those falls often lead to death within months or years after a fall, particularly in the elderly that sustain fractures or head injury during a fall. So exercise can also help with fall prevention through some of the elements that we discussed before. Improve balance, improve coordination, improve agility. Even if you're able to fall, you're able to brace the fall better. If you're exercising, you're strengthening your bones, so you're less likely to have a major fracture from a fall. And then this leads to effects that are also improving to overall function in the elderly and also in younger patients. So, as I said before, we could talk for hours about the benefits of exercise and all the different studies that underlie each of these bullet points. But I just wanted to emphasize so that, at an intellectual level, you realize that exercise is the best thing you can do for yourself. And that's why we're doing this program today. We often get questions. I often get questions from patients. What is it that I can do to help support my overall health? Outside my treatment. And patients are always interested in supplements or specific foods or diets. All those things play a role. And it's important to make sure that you have adequate nutrition, and if you have any kind of vitamin or mineral deficiency, that is addressed. But in the big equation of overall health, there's nothing, absolutely nothing that compares to the benefits of exercise. There's no diet, no supplement that you can take. If you're participating in an exercise routine, you're doing for yourself the most important thing that you can do to maintain your overall health. It is because of this then that major societies, including the American Society for Clinical Oncology, ASCO, have specific guidelines that address exercise. And this is a more extensive guideline that also addresses diet and weight management. But I just want to emphasize that exercise is the main pillar here. And the guideline, I won't read it to you, but it states that oncology providers should recommend aerobic and resistance exercise during active treatment with curative intent to mitigate side effects of cancer treatment. And it highlights that this is evidence-based and that the benefits outweigh any potential harms. And we will talk about potential risks of exercise. And there are a number of studies, so they can assess that the level of the evidence is moderate to low, because overall there's little research that has been dedicated specifically to cancer patients. I'll highlight some studies that have been done in brain tumor patients, but there are no major studies of the kind of studies that we often do to approve a new medication to treat a cancer. So for example, a new type of chemotherapy or targeted therapy. For those studies, we do a study where we involve large numbers of patients, and we assign the treatment to one group and we don't assign the treatment to the other group. And then we follow the patients over time and we see how they do. And those are called randomized controlled trials. They're very expensive. They take a long time to conduct. And they're often, performed with the assistance of pharmaceutical companies that contribute to, the funding of a study. Oftentimes because, the drug being studied is a drug that they produce. For exercise, this is available to everyone, and there is no large funding to do large randomized control studies of the kind that we often do to recommend a specific cancer therapy. But that is not to say that these therapies are not effective. And in aggregate, looking at many studies, hundreds of studies done not only for cancer but for other conditions, we know that exercise should be recommended. But already with the level of evidence that we have, the American Society for Clinical Oncology recommend that oncologists discuss aerobic and resistance exercise with their patients. And this is something that I do with my patients. If you're under my care, you know that we have talked about this, and this is something that other colleagues do as well. But we want to emphasize that more needs to be done. The American College of Sports Medicine, which is another major medical society, also has guidelines for cancer survivors. And they state in this publication where they describe the guidelines, but I'll just read you here in the summary of the results. They say, enough evidence was available to conclude that specific doses of combined aerobic plus resistance training and/or resistance training could improve common cancer-related health outcomes, including anxiety, depressive symptoms, fatigue, physical function, and health-related quality of life. Implications for other outcomes such as peripheral neuropathy and cognitive function remain uncertain. So they're saying there's already abundant evidence to recommend exercise as beneficial for a number of health cancer related issues. And for some others, we still don't have enough evidence, should be studied more, but they're also recommending exercise. This is from a program of the American College of Sports Medicine called Exercise is Medicine, that discusses different exercise prescriptions. And, we will get more into this in part 2 of this webinar, but I wanted to highlight that, there are specific recommendations of dose of exercise for aerobic exercise and resistance exercise, for cancer-related fatigue, for health-related quality of life, for physical function, for anxiety, depression, lymphedema, which is inflammation and swelling that occurs oftentimes in patients after they receive radiation to their chest or other areas of the body. Also for bone health and for sleep. The American Cancer Society, another major medical society and cancer society, also recommends exercise for cancer patients and cancer survivors. And we'll get into the specific recommendations when we talk about how and for how long. And then I wanted to note that the National Comprehensive Cancer Network, which is a network of major cancer centers throughout the United States, also has specific recommendations for exercise for the management of cancer-related fatigue. Also specific recommendations on physical activity for cancer patients. And one graph that I think is very compelling is that many patients think, well, I don't exercise, and I think it will take me a while for me to ramp up my exercise regimen to get any kind of benefit. But the reality is that if you start from being completely sedentary, not doing any exercise, and you implement the basic recommendations of achieving about 150 minutes to 300 minutes of moderate intensity activity, you will soon, 150 minutes is about 20 minutes per day. It's not a lot of time. It's maybe I don't know of any show on TV that has an episode that is 20 minutes or so. So it is definitely something that we can try to carve time in our routine to do. So if you start from sedentary and you just get into the range of 150 to 300 minutes, equivalent to about 8.25 MET hours per week. That's why we discussed METs early on. Then you're already getting the major benefit in terms of mortality. So this is plotting hazard ratio, which is the risk of you experiencing a certain outcome. In this case, death. So if you're sedentary, you're here, but then if you start exercising, your risk drops down fairly quickly, so that by getting just to the standard recommendations, the Surgeon General recommendations, you decrease your hazard ratio, your risk of death by 30%. This is all comers. This is a study in the general population, but the point that I'm trying to drive here is that you can get a significant benefit from exercise, even if you exercise at the lower level of the recommendations. There's further benefit if you continue exercising, but you don't need to do that much in order to gain an important benefit. And there have been different studies that have looked into the difference between 150 minutes to 300 minutes, so 20 or so minutes per day to 40 minutes per day. And obviously there is an increasing benefit by exercising more. And if patients improve their exercise capacity, can build it up, and you get additional benefit exercising more often and for a longer period of time. The reality, though, is that very few individuals in the United States meet the guidelines in terms of exercise. And the opposite side of this is that there are many individuals that suffer from all the health-related problems of lack of exercise. But you see that it is hovering around 20%, 20 something percent for men, and has been at this level for a long time, and it's even lower for women. And another problem is that in our younger population, high school students, they're also not meeting the exercise requirements. This is a recent analysis. It was published just a few weeks back, looking at the effect of exercise on cancer mortality, because I showed you that figure before, showing that there was a benefit all comers, but this was done for cancer patients. And then you see that no exercise is a higher cumulative risk of mortality. Below exercise guidelines, but doing something, you're doing better. Meeting the exercise guidelines, you're doing yet even you have better odds in terms of survival. And then if you're working even beyond the exercise guidelines, you're doing even better. So again, another point to emphasize. And we have some data on this for high-grade glioma, such as glioblastoma or high-grade IDH mutant glioma. This was studied by colleagues almost a decade ago, and they were looking at levels of exercise, and those that were exercising greater or equal to 9 METs per week, MET hours per week, were doing better over time in terms of survival than those that weren't. And this was adjusted by different limitations that patients had based on their disease. So the study also looked at patients that were exercising before the diagnosis and continued exercising. Those did better. But even those that were not exercising but then started exercising after a diagnosis did better if they exercise at this level, which is more or less 9 MET hours per week is more or less the standard Surgeon General recommendations. And again, we'll get into a lot more detail about this in the second part of this program. There has been a small study looking at effects on cognitive function in patients with glioma through exercise, and this study has a signal of improvement of cognitive function through exercise. Also, another small study looking at effects on fatigue, specifically in glioma patients, and improved sleep, and exercise helping with both. And then a large review, that aggregates different studies also shows a benefit of exercise for patients with primary brain tumors. So in summary, there is evidence that exercise is an effective addition to standard therapies in patients with cancer. This is reflected in recommendations from guidelines for several societies. We reviewed the American Society of Clinical Oncology, the American College of Sports Medicine, the American Cancer Society recommendations, all of them, encouraging cancer patients to exercise. For brain tumor patients, the evidence is limited. There haven't been many studies, but the evidence that is available suggests that higher exercise capacity correlates with improved overall survival. This mainly studying patients with high-grade glioma, and that higher exercise capacity correlates with lower impact from treatments, radiation and chemotherapy, on quality of life measures, particularly fatigue, and possibly in cognitive function. Um, so, the bottom line is that we need to get our brain tumor patients to exercise if they're not exercising already. And it's important to address exercise since it is such a powerful intervention. I think it's reasonable to call it a medicine, given the many effects, beneficial effects on health that it has. We need to address it at our visits and help our patients start an exercise program. So I hope I've given you enough information to be excited about starting an exercise program. I will be providing more information on how to do so safely and in a way that is sustainable. So I invite you to join me again on October 11 at 3:30 p.m. And if you haven't done so, if you're not getting our emails, send us an email to receive more information regarding our programs. And with that, I will close in. And let's see, we have a question here. Can't say enough good things about this cancer support and exercise program. Someone is recommending a program through the Livestrong Foundation. There are different programs, here at the Dana-Farber, we have a center, the SAKIM Center, which has a number of specific exercise classes. Some of them are online, and I will point you to this resource at the next meeting when we talk about the how and when. And I know that there are other ones out there that are very good. So I thank this viewer for recommending this one through the Livestrong Foundation and the YMCA, and I will look into it. If there are no other questions, we will leave it at that. And this program will be available on YouTube at the Blum Center website, and you can review it on your own time to go over it and see some of the things we discussed. And I will summarize some of these things when we meet again on October 11th. Thank you all so much for joining me today and for your attention.
Thank you so much. This was another great presentation. And in the YouTube description, we will definitely link to the ZAKM as well. So we will link to My ZAKM, where you can look at all the classes that they have online and in person. So thank you all again for joining us, and I hope to see you all next time as well.